And I just want to add, I am with you on getting dairy products out of our diet, especially cow dairy. It's one thing to have a little sheep and goat cheese from time to time, but the milk itself is it does contribute to mucus production. So
Right.
especially now in these winter months when we tend to pick up a little bit more mucus, mucus is a reservoir for microbes to live in. And cutting back on your dairy intake is one of the wisest things you can do.
Critically important, critically important. And I was talking about the, it's embarrassing to say 40 years ago, but we would say, look, dairy milk is meant for a cow. Do you want to look like a cow? And if you just sit in a coffee shop and watch the people go by, unfortunately, so many are packing extra weight. And most of them say, oh, but I love my cheese. And don't associate that these proteins you're getting are creating so much mucus, as Dr. Sally just said, and you can't digest these proteins thoroughly, and you get this toxic residue that gets stored in your fat cells, and you get bigger because your fat cells are plugging up. And this mucus, we used to talk about that a lot. I don't think we've ever had a case of recurrent sinus infections or recurrent ear infections that we didn't make dramatically better just by getting them off dairy. That's the first step, because mucus, when people have recurrent sinus infections, Mrs. Patient, or recurrent ear infections, your daughter is a human petri dish. Remember petri dishes that bacteria grow in? Well, when you eat dairy, when you get all this mucus and like that, you get all this mucus, bacteria loves to hang out in your sinuses or loves to hang out in your ear canal because there's no white blood cells, there's no immune system in the mucus because there's no blood vessels going into the mucus. There's no lymphatic vessels going into the mucus. It's just mucus. It's a petri dish. So bacteria grows in there, and when there's so much bacteria, now it touches up against the side of your ear canal or the side of your sinuses, and now you get inflammation on the side of the ear canal. Now you hurt. Now you've got an ear infection. Well, you've had an infection for weeks, most likely, but it was just in the mucus. That high concentration of bacteria was in the mucus. So the first thing you do for recurrent infections is get the mucus out. And the first thing you do to get the mucus out is get the dairy out. Oh, but I love my cheese. We'll put that on your tombstone. She loved her cheese.